Okay.
Dr. Lee, I just got a report. I read a report from New Jersey actually it's not just now, it was about a month ago or so. A bus driver wrapped a bus around a ball and killed lots of people, and they suspect sleep apnea being the cause. They say more people die on the highway from people having sleep apnea. Basically, they pass out in the afternoon, fall asleep, just like bang, like that. Then there's people dying of drunk driving. And dentists have a lot to do with fixing sleep apnea. Why don't you tell us about it?
Well, sleep apnea is a condition where you stop breathing at nighttime. You might stop breathing hundreds of times during the nighttime, and you might stop breathing for about a minute at a time. Now, your body definitely needs the oxygen to replenish your body and to heal itself. And if you're waking up every day, you're very tired because you're not getting a restful sleep, that's going to affect your performance throughout the day with any task that you take on. Now, of course, if you're responsible for a lot of people, like driving a bus, and that's really unfortunate to happen, it's a very serious condition. If you're, the way dentists will go ahead and do their role in sleep apnea, the CPAP, which is pressurized air that goes, you wear a mask and you have that air that's unfortunately passed through your body. That is really the gold standard for trying to treat sleep apnea when the patient sleeps. Now, some people can't tolerate that, or if they travel a lot, it's going to be hard for them to carry around that bulky machine. So what dentists do, we can construct your oral appliances that you can wear instead of the CPAP machine that you can conveniently take anywhere you go. It's not very intrusive, and it allows your jaw to be repositioned so it can open up your airway and you can sleep without not breathing.
Right, I definitely have heard about that. The gold standard is the machine which puts just normal ambient air, with a little pressure in your mouth. But in fact, I'm a second-hand witness of that, my wife. And here's the thing, my wife is the most disciplined person you can possibly find. If she thinks something is good, she'll go through all hula hoops to do it. That CPAP machine, it was just hell. Besides the fact that it was louder than her snoring. I mean, it was more, well, maybe it wasn't louder, but it was less natural. At least,
Right.
I mean, you're in love with your wife, at least I am, and over 25 years, you get kind of, it's kind of like sometimes I was laying there and it was like, oh wow, she must be sleeping really well because she snores away. Do you know what I mean? And with this machine, but that pumping, that's an unnatural type of stuff. The wind,
Right.
some people is a soothing thing at night, but if they gutter rattles, that's not the same. You know what I mean?
Right.
So it's a little bit like that. And I remember having had a sports teacher once, and I asked him which exercise. Well, actually, he wasn't my sports teacher. He was a sports teacher, I know. And I said, so what's the best exercise to do? And he looked at me. He says, Helmut, it's the one you will do. And, I expected some huge philosophical thing like swimming or whatever. And he told me, it's the one you will do. So the little mouth guard people will wear. My wife is wearing it. And yes, her energy level is up, and, quite nicely. She loves it. In terms of that. And yes, she travels a lot. So, I mean, that is very easy to carry around. Now, is it true that most people who snore do have sleep apnea? Not all, but most.
Right. Yeah. A lot of people who snore may have sleep apnea. The snoring, you get the sound from the snoring because the airway gets constricted, and you start to get that vibration in the back of the throat.
Mm-hmm.
If your airway is that limited, it's always possible that your breathing is actually stopping when you sleep, and that's pretty alarming. You're basically affecting your overall health because you can't breathe properly. So if you're snoring and you have certain signs like you're obese, or you might be taking certain drugs, drinking a lot of alcohol, all those things can contribute to a narrowed airway where you might stop breathing when you sleep at night.
Well, it's not so much that so many people die, even though they might not know, because then he died, but there probably not too many people die from it. But as you mentioned, their lifestyle next day, they're exhausted, their diet, they have problem driving, problem concentrating for work, and just like a more grouchy. And of course, if you deprive your brain day in, day out for 40, 50, 60 years of oxygen throughout the night, no wonder you get dementia a little faster and earlier. I mean, right?
Right. Yeah. Your brain needs its oxygen. Your organs need their oxygen in order to function properly. If your oxygen level goes down, then certain other functions start to slow down. So you want to make sure, most likely you're not going to die in your sleep. Your body has its reflexes where, it's going to kick up your breathing again. But if you stop breathing for a minute at a time, which, a lot of people can hold their breath for a minute, but if you keep on doing that, then, you're depriving your body of the precious oxygen that it needs.
Right, and that's where this exhausted feeling comes, and that's where, and people apparently, literally, not slowly, but like, within a split second, literally pass out. They say the people who are drunk driving have less severe accidents because at least in the last second they try to straighten the baby out. But people who passed out with sleep apnea, they're just going straight towards the hill, Right. Now let me ask you this. There's data out there that, people do a test in a sleep lab. But those things are rather expensive. They cost $1,000 and whatever. Now, just let me ask you this. I mean, if a person is whatever, heavy, severe, blah, 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 whatever, fine, go ahead and do the test. But here's the thing. The person snores. The person thinks that he could have more energy next day. Most of us think that one way or the other way maybe anyway. But, knowing what happens, because you probably had a dimmer switch, you don't even know that you could be more energetic because it became your lifestyle. So a person snores. A person could imagine more energy. What's the big deal of just going to a dentist, get us one of those sleep apnea appliances, which are not really all that expensive, and see the difference in lifestyle? Even if you didn't really have sleep apnea, you very most likely, or 100%, I don't know, but most likely stopped snoring, and that for your partner couldn't be such a bad thing in the first place.
Right. If you're snoring, it wouldn't be a bad idea to just get an appliance that's going to reposition your jaw and open your airway. You're getting more air in your body, and you're gonna be less likely to be tossing and turning because you're not getting a restful sleep. So it's not a bad idea if you snore, both for yourself and your partner, to get an appliance that'll do that. Because you only snore because your airway is narrowed, and if your airway is narrowed, then you're still not getting the oxygen you need, and you're most likely not as energetic as you could be.
Mm-hmm. Because after all, we sleep more or less 1/3 of our life. 8 hours is what we should sleep, and hopefully most people get it. Again, here's the thing. People sleeping a lot, by a lot, meaning the normal dose of 8 hours, it is so healthy versus people sleeping only 4, 5, and 6 hours. There's been many, many studies how people go insane. Again, all kinds of stuff happens. So if you wake up or not go into that deep sleep, right? I mean, the sleep apnea it prevents you from going into the deep sleep. So you're sleeping, but you're not sleeping. Is that a good analogy?
Yeah, you do need a few cycles of that deep sleep in order for your body to become rested. But if your body can't get into that deep state because it's not relaxed enough, then you're staying in very light, shallow sleep your whole night, and you're not really able to replenish and recoup your body's functions.
Well, wonderful. Well, perhaps due to the fact that if people like you and the media and us makes it aware, because it's such a small problem, so huge effect on the everyday life, and it's amazing how many very, very bad lifestyle effect can be fixed with dentistry. We talked about headaches because your jaw is out of alignment, because you may have missing teeth or other reasons, but your jaw is out of alignment. Headaches, pain, shoulder. We talked about being fatigue, tired, ruining your kidney, liver because of gum disease. Now we again raise the energy because of fixing sleep apnea with a very, rather inexpensive and rather comfortable non-bothering, not invasive dental procedure by putting a little mouth guard on. Dr. Lee, always very wonderful to talk to you. Bye-bye.
Thank you.